There's finally a growing sense of optimism as we approach the 2-year mark of the pandemic. Omicron seems to be leaving as quickly as it arrived. Furthermore, all the important indicators are improving, and at quite a pace. Now, March is a week away, and we're going to see big changes. There's going to be a significant reduction in a number of the public health measures. Most importantly, there's going to be a suspension of the proof of vaccination required for certain settings. Now, listen, we've worked hard to keep Omicron at bay, and it's been a long, tough winter. And fair to say that there's an exasperation level that's sky high for all of us, and we want to reach a new normal. However, we have to remind ourselves that the beginning of the end is not the end. We need to be very careful, at least until the middle of March, and I would argue until the end of March. Renfrew County is 2 to 3 weeks behind the urban centers in Ontario, Toronto, and Ottawa. And it's these urban centers that are driving the decisions by the government. So we have to be very careful. Our number of outbreaks, our hospitalizations, and our deaths, while they're coming down, they are still too high. In Pembroke, the wastewater measures for Omicron, for COVID-19 are high. They're higher than all but one other place in Ontario. And this is a significant indicator of the level of disease there is in the community. So we have a long way to go, another few weeks, hopefully not more than a month, but we don't want to go backwards. And what does this mean? It means that each and every one of us has to be vigilant and to be careful, and we have to do what we can. Now, for starters, immunity for COVID-19, unlike a lot of other diseases, does not last. It doesn't matter if you got a vaccination or whether you've had the disease. We see that immunity wanes very quickly. What does this mean? It means that anyone who can get an additional shot, a first shot, a second shot, a booster, they should do this. Now, if you're over the age of 12, that means you can have 3 vaccinations. If you're immunocompromised or living in a congregate care setting, you can have 4. And what's really bothersome is that we have seen that our numbers for children between the ages of 5 and 11 have not yet approached 50%. This is a concern. These children can not only get the disease, but they can spread it more readily if they're unvaccinated. So we need to take advantage of the vaccination clinics. Furthermore, masking, distancing, and hand hygiene are as important as ever. Masks can reduce the spread of disease by 50 to 80%, and distancing adds to that benefit. Now, a lot of us are fed up. We want to take those masks off, but we have to wait respectfully and patiently for the province to tell us when we can do that. Furthermore, a number of people are going to be wearing masks for months and maybe years after the mask requirement has been lifted. So we need to be respectful, we need to be patient, and we need to be kind so that we can observe the rights of individuals, and so that people can have their own risk tolerance and do what they need to do to be reassured. Now, equally important, and probably most important, is the size of social groupings. There's still plenty of Omicron out in the community, and winter is not over, so lots of our activities are still inside. Carefree activities in large groups should be discouraged. This is where we can get potential for a super spread, and that can turn things around and wreak havoc in the community. So the best way to prevent this from happening is another month of vigilance when it comes to social gathering. This is really important. Now here we are, we're getting closer and closer to a new normal, but as I said, because Renfrew County lags 2 to 3 weeks behind the rest of Ontario, we have to be very careful. And this is particularly important for the upcoming weeks and probably until the end of March. So look, we can see the future out there. We can see the light at the end of the tunnel. The rewards are going to be great, but I urge you to do your part and keep up the good work to get us through the month of March. Thank you very much.